Good evening, everybody, and welcome to Call the Doctor. I have my co-host Gene here and a special guest tonight, Dr. Todd Hobgood. He's got a tough act to follow from last week. Dr. Lee Isley demonstrated to us how he's and his wonderful administration team is steering the quality of health care in our community down the road to excellence. And where that rubber hits the road within the hospital, Dr. Hobgood drives a lot of that bus. He's the head of the anesthesia department. Tell us what got you interested in medicine. You had a diverse beginning.
So I was always interested in biology and physiology from a young kid all the way through high school. I excelled exceptionally in biology in high school, went to college and studied that, but I always wanted to do something where I could take my interest and knowledge in that and apply it to actual human interaction with people and helping people. So I felt like those two things intersected with medicine, and I took sort of a convoluted path to becoming a doctor. My first career was a physician assistant. I worked for about 4 years as a physician assistant, 1 year in the neurosurgery practice, where I had my first exposure to anesthesiology. And then after that, I ended up working for about 3 or 4 years in a primary care clinic, internal medicine practice. But the anesthesiology experience that I had as a PA in the operating room was always in the back of my mind. So when I decided to go back to medical school, I knew that anesthesiology was where I wanted to go because it appealed to me. The procedures, I love doing procedures. I love the physiology, the pharmacology that's involved, the fast-paced nature of the specialty, and probably most importantly, the connection that I make with the patient. It's brief, but it's very meaningful, and knowing that you can alleviate one's fears. Someone in that pre-op room is one of the most anxious points of their life, and you can take that person, calm their fears, safely navigate them through the perioperative process, and when they leave the recovery room to go home or go to their hospital room, and they're pain-free and they're comfortable and they're relaxed, that's a rewarding feeling.
Mm-hmm. It's very rewarding, and one of the most rewarding feelings is when you know that it's one of your neighbors taking care of you. So you live in the community, don't you?
Right.
We find that that's important. In fact, we talked about it on previous shows, how it's almost a requirement now for new surgeons and other staff members to be members of our community. Mm-hmm. And so valuable contributors to the hospital are also valuable members of our community because we work where we live, mm-hmm. and then that's important.
And your sons go to school here.
Right. I'm originally from Wilson, and I've been here in Rocky Mount since about 2002, so essentially 20 years. I've been in this community and plan to stay in this community.
Super.
the rest of my life.